Welcome to eCareDiary.com's Caregiver Tips and Clips. I'm your host Meghna Deodar. Each week we will focus on a caregiving issue in the form of a short educational video. Today's video focuses on cataracts, types, risk factors, symptoms, and detection. In 2015, according to estimates, 3.6 million cataract procedures will be performed in the US. Most cataracts are related to aging and are very common in older people. By 80, more than half of all Americans either have a cataract or have had cataract surgery. So what is a cataract? A cataract is a clouding of the lens in the eye that affects vision. It can occur in either one or both eyes, but cannot spread from one eye to the other. The lens is a clear part of the eye that helps to focus light on the retina, which is the light-sensitive tissue at the back of the eye. In a normal eye, light passes through the transparent lens to the retina. Once it reaches the retina, it is changed into nerve signals that are sent to the brain. The lens is made up mostly of water and protein, but as we get older, some of the protein clumps together. This clouds a small area of the lens, which is called a cataract. Over time, cataracts may grow larger and cloud more of the lens, making it harder to see. Although most cataracts are related to aging, there are other types of cataract. Secondary cataract is one that forms after surgery for other eye problems such as glaucoma. Traumatic cataract can develop after an eye injury. Radiation cataract develops after exposure to some types of radiation. Other cataracts that affect different parts of the lens include nuclear cataracts that affect the center of the lens, cortical cataracts which affect the edges of the lens, and posterior subcapsular cataracts that affect the back of the lens. Some cataracts are related to genetic factors that cause other health problems. They can also be caused by other eye conditions, medical conditions such as diabetes, trauma, or past eye surgery. Long-term use of steroid medications is also one of the causes. The risk of cataract increases as you get older. Early factors discussed are family history, radiation, eye surgery, or injury. Other risk factors include smoking, drinking excessive amounts of alcohol, high blood pressure, and obesity. The most common symptoms of a cataract are cloudy or blurry vision, double vision, or multiple images in one eye. More often than not, colors seem faded. Frequently changing your prescription in your eyeglasses or contact lenses and being affected by bright sunlight are some of the other symptoms. These symptoms can also be a sign of other eye problems, so it is imperative to get checked by an eye doctor immediately. Cataract is detected through a detailed eye exam that includes visual acuity test, which is the eye chart test that measures how well you see at various distances. Then there is the dilated eye exam. Drops are placed in your eyes to widen or dilate the pupils. The doctor then uses a special magnifying lens to examine the retina and optic nerve for signs of damages. After the exam, close-up vision may remain blurred for several hours. Tonometry is an instrument that measures the pressure inside the eye. For this procedure, numbing drops may be applied to the eye. The eye doctor may also do other tests to learn more about the structure and health of your eye before deciding treatment. To ensure prevention, protecting yourself from the bright glare of the sun with shades and a hat is recommended. It is best to avoid smoking and drinking. Good nutrition is the cornerstone of health associated with your eyes. Consuming a diet of green vegetables, fruit, and other foods with antioxidants is also helpful. In addition, it is wise to get a dilated eye exam once in 2 years, especially if you're 60 or older. Early detection is the best way to save your eyesight. Thank you for joining us today. To access more caregiver tips and clips, visit us at www.ecarediary.com. Until next time.